Hello, in this short video I'm going to talk about a study we did as part of the London York Policy Reviews facility on caffeinated energy drinks and children. The London York Policy Reviews facility is a collaboration between researchers at the University of York, University College London and the London School of Hygiene and Tropical Medicine. I'll talk about why we did this work, how we did it, the results that we found and what these could mean for parents and children. So why did we do this study? We were asked to do this research by the NIHR PRP for the UK Department of Health and Social Care. Caffeinated energy drinks can contain as much caffeine as an espresso. As caffeine is a stimulant that can have harmful effects, they wanted to know how many children in the UK drink caffeinated energy drinks, and do these drinks cause them any harm? These drinks include brands such as Rockstar, Monster and Red Bull, among others. Several large supermarket chains have policies not to sell energy drinks to children, but smaller retailers and local shops do not, so children can still buy these drinks. There were two parts to this study. The first was a systematic review of systematic reviews, in which we gathered the evidence from all available reviews, assessed their methods for any bias, and combined this evidence to find any gaps and where the evidence was consistent or not. We included reviews that selected studies on children younger than 18 years that measured how much children drank or compared outcomes, such as headaches, depression, or sleep issues, between children who drank energy drinks and those who did not. The second part of the study was an analysis of information from UK datasets, such as the National Diet and Nutrition Survey. For this, we included datasets that had information on how many energy drinks children drank and their physical or mental health or behaviour. We found 15 systematic reviews and 5 UK datasets that met our criteria for inclusion. Combining the evidence from the reviews, we found that internationally, up to 2/3 of children had drunk one or more energy drink in the past year, while in the UK, the dataset suggested that up to 1/3 of children drink them once a week or more. From both sources, we found associations between drinking energy drinks and poor health and behaviour, including headaches, sleep problems, alcohol use, smoking, irritability and school exclusion, but an association does not mean that one causes the other. There could be another common cause such as deprivation. The dataset analysis suggested that energy drink consumption was one of a cluster of factors such as smoking and school exclusion that were associated with low general well-being. In the reviews, trials with fewer than 15 children found improved sports performance with drinking, as well as dose-dependent changes in blood pressure and improved sleep with an intervention that included cutting out energy drinks. There were single studies that suggested that knowledge about the content of drinks was low, and those who knew that the drinks might be harmful drank less. Children's motives for drinking included taste and energy, but also both parental approval and parental disapproval. The context for drinking was often at parties or for exams. What does this mean? The answers to our two questions were that it is quite common for UK children to have energy drinks, and the evidence suggests that these drinks could be affecting children's health and behaviour. But most of the evidence was from surveys which assessed children at one point in time, and these cannot show that one thing causes another, and randomised controlled trials are unlikely to be ethical. The evidence on motives suggests that a ban might encourage some children and discourage others, and improving knowledge about the content of the drinks might be helpful, but only if children in the UK are unaware that the content might be harmful. If a ban or other intervention is introduced, assessing children before and after the intervention with regular follow-up assessments could provide stronger evidence for an association as well as for the effectiveness of the intervention. Repeating surveys over a child's lifetime could also strengthen the evidence on any associations. The research paper can be found on the BMJ Open website, and the full report is on the EPPI Centre website. Thank you for listening. Bye.